everyone, my name is Kene Mezue. I'm a nuclear cardiology fellow at the Massachusetts General Hospital in Boston, and I'd like to tell you a bit about our study, which was accepted for an oral presentation at ACC.21. Our study is titled Alcohol's Beneficial Effect on Cardiovascular Disease is Partially Mediated through Modulation of Stress-Associated Brain Activity. Alcohol is known to have a J-shaped relationship with cardiovascular disease, with moderate intake of alcohol associated with a lower level of cardiovascular events compared to excessive as well as low levels of alcohol intake. However, the mechanism of moderate alcohol intake's benefit in cardiovascular disease is uncertain. We do know that chronic stress leads to an increased risk of cardiovascular events, and studies have shown that chronic stress activates certain regions of the brain that lead in a serial mechanism to increased leukopoiesis, atherosclerosis and inflammation, and eventually cardiovascular events. Alcohol has been shown in a few studies to acutely reduce activity in those same brain regions. And so we asked the question, could the beneficial effect of alcohol be due to its chronic effect in reducing activity in those same regions of the brain? Our study population was derived from the Mass General Brigham Biobank, which was established in April of 2010 and recruits study subjects in the Boston area. Out of approximately 119,000 patients in the biobank, about 53,000 filled a health survey from which we derived alcohol intake data, and a smaller subset of patients had positron emission tomography scans which were done for clinical reasons, and from these scans we derived stress-associated neural activity, which was reflected as a balance between amygdala activity and prefrontal cortical activity using previously validated methods. In the larger cohort of about 53,000 study subjects, we found that moderate alcohol intake was significantly associated with a 20% reduction in cardiovascular events in a fully adjusted logistic regression model that included cardiovascular risk factors, health behaviors, socioeconomic risk factors, and psychiatric factors. We also found that in the smaller subset of patients that had brain imaging, moderate alcohol intake was significantly associated with a reduced level of amygdala activity. A very interesting relationship we found was that there was a J-shaped relationship between both alcohol intake and cardiovascular events, as well as alcohol intake and brain activity. And in a mediation model, we found that stress-associated neural activity significantly mediated the beneficial impact of alcohol on cardiovascular events. Our study's take-home message is not that alcohol should be prescribed, because we know that moderate alcohol intake has deleterious effects which include cancer risk and dependence. However, we think that this pathway merits further study so that we can in the future develop therapeutics that could potentially utilize this pathway to reduce cardiovascular events without the deleterious effects of alcohol. Refocus, reconnect, and reimagine at ACC.21.